doctor has experienced pain like many never will.
She fought for years to save her sons from mental illness. Now she wants to save other families from a life-altering tragedy. Rob Messon has more on her personal journey in a mother's loss.
And they were just both bright, beautiful, highly intelligent boys.
A household torn apart by a problem that crosses all income, racial, and age lines. A problem this North Shore neurologist found overwhelming her sons.
My younger son first became sick at 20, very sick, and it was really quick. My older son, it was more of a slow, kind of insidious, unfolding process.
Dr. Ann Kahn devotes her life to studying and treating problems with the human brain. But she and some of the country's best brain doctors found themselves powerless to prevent not one, but two of her sons from taking their own lives.
They're both missed so much by myself, our family, and their friends.
In 2014, 24-year-old Colin, a promising LSU student, overdosed on medications designed to treat his mental illness. 1 year later, Dr. Kahn suffered the unthinkable when her other son, Austin, shot himself.
And the pattern for both of them was the same. Once they got manic and psychotic, they never recovered. And it's unusual.
Unusual because Dr. Kahn says neither responded to treatment. Doctors diagnosed both of her sons with bipolar disorder while they suffered from psychotic episodes and often hallucinated. She says her medical background, along with a family history of mental illness, helped her understand their struggle. The boys went to some of the best hospitals in the country for care.
We were very fortunate in that both of my sons received excellent treatment, but we were quite unfortunate because both of them had the type of disease that did not respond to treatment.
Dr. Kahn now makes it her mission to help others try to understand the mysteries of suicide. She says 90% of the time they're driven by mental illness, which doctors can often see in an MRI.
There are studies involving functional MRI, which is a type of MRI that doesn't just take a snapshot, which are the MRIs we're most familiar with. It watches the brain work.
She also wants others to know that despite her family's tragedy, mental illness is usually treatable.
The type of disease was not treatment responsive.
The problem isn't going away.
I've been on 7 calls in the last 4 weeks.
Pat Mashburn is part of the team that warns others of the impact of suicide and helps families cope after their loved ones take their lives.
That I tell them is, yes, this is going to change you forever. It doesn't mean you can't be a whole person again. You're going to be a different person.
Mashburn's team steps in where law enforcement stops.
I've investigated and been on scenes of many suicides, and law enforcement were focused so much on the crime scene itself that we sometimes ignored the needs of the family.
The suicide team, called LOSS for local outreach to suicide survivors, moves in quickly and stays as long as it takes.
You know, people want to tie this up into a nice, neat little package to help them understand, but suicide is actually very complex.
In 2014, 46 people, an all-time high, committed suicide in St. Tammany Parish. Dr. Kahn urges families to work hard to remove the stigma of mental illness, pay attention to the warning signs, and seek treatment.
Well, I think we need to talk about it. Okay, I mean, people can be secretive about suicides. I think that's changing, and it needs to change because the secret is the poison, and we need to tell the truth.
And she hopes her message resonates so others won't have to experience her pain. From the North Shore, Rob Messon, Fox 8 News.
Dr. Kahn says it's not easy, but she says anyone who is contemplating suicide or knows someone who is needs to call 911 or the LOSS team before it is too late. There are services available. We have a link on our website, fox8live.com.
The eighth ring